A shot of a quiet street, followed by a montage of people alone in their homes.
The COVID-19 pandemic has hit many communities hard, especially the disabled community.
I didn't know where to reach out. I didn't know who to call.
The pandemic has really opened our eyes to where we're falling short.
How do you tell someone with a visual impairment to stand 6 feet apart when they don't know who's around them?
An aerial shot of the city.
Thanks to funding from the City of Toronto, the Alliance for Equality of Blind Canadians Toronto chapter was able to take the steps to help their own. This is the City of Toronto COVID-19 Relief Project.
We see the City of Toronto logo, the AEBC logo, and the project logo fade up and then out. The montage ends. Minette Samaru, president of the AEBC Toronto chapter and project lead, speaks to the camera from her living room.
The COVID-19 Relief Project is a City of Toronto funded project that is designed to provide services to persons with disabilities that are experiencing social isolation and communication access barriers during COVID-19.
Fade to a drone shot of the city with text that reads,
This project had 3 main goals. The first was to conduct a consultation and needs assessment with disabled and marginalized communities on the impact of COVID-19.
Here's Minette again.
We have identified a number of barriers, and based on that, we provided mindfulness training and gathering information with regards to COVID-19.
Christine Zanier, disability inclusion consultant and project coordinator, speaks to camera from her backyard.
It was really about looking at the challenges and barriers that people with disabilities were facing.
Wendy Huang, a visually impaired single mother, sits in front of the camera.
When COVID hit, everything was locked down. Nobody could see anybody. There was a lot of, fear. I didn't know how to get access to even just a computer because using my whatever usable vision I had to read the screen, it was very tiresome.
A shot of Wendy staring at her computer.
It took me about probably like an hour or more just to read one paragraph.
Back to Wendy speaking to camera.
And it also hindered me to not be able to participate in my daughter's homework. When she had questions and things like that, I wasn't able to help her with any of those things.
Fade to another aerial shot of the city with text that reads,
The second goal was to provide assistive devices to help the most isolated stay connected and access information during these challenging times.
Linda Spinney, vice president of the AEBC Toronto chapter, and her husband Chris sit on their porch swing outside.
There's a lot of setup and programming in these iPhones before giving them to the recipients.
Close-up of someone unboxing a smartphone.
What kind of adaptive devices do they use at home and what would they like on the iPhone?
Back to Linda and Chris.
Many of the people who are receiving these iPhones were on a fixed income. Finding companies that provide an economical data plan was important.
We see someone on their smartphone, then back to a shot of Wendy with text reading,
Wendy was one of the 20 recipients of assistive devices. These devices included 18 iPhone 8s and 2 laptop computers.
Because of the technology that was provided, I'm right now volunteering in non-profit organization groups that I've never did before, or that I couldn't think of what I could do. And I'm also just started school.
Fade to another shot of the city with text that reads,
The third goal was to provide accessibility training to businesses and organizations.
Several speakers present at a Zoom workshop.
AEBC held workshops that helped businesses create disability-focused accessibility action plans and emergency evacuation plans.
The words accessible action plans and emergency evacuation plans appear next to the Zoom workshop before fading to Christine.
Some of the recommendations were around inclusive design policy making and including people with disabilities. The second one was leadership support was really critical. You need to lead by example and provide support. And you also need to retain talent and keep inclusion talent front and center. And the last one was really providing full accessibility to all employees and staff at all the businesses.
Fade back to Minette. As she speaks, her words appear on screen.
A fourth objective was also identified, which is the need to provide training to students and educators on accessible education and universal design learning.
We fade to another woman facing the camera.
My name is Elizabeth Moeller, and I am a first-year doctoral student at Western University.
A close-up of Elizabeth's diplomas before cutting back to her.
The accessible education workshops really were a platform to come together and talk about some of the challenges that we've been facing, but then to move beyond that and bring together some solutions and strategies around how we're going to move forward and sort of think about what we've learned, the learnings of COVID, and how we can sort of take this moment and make it a transformative one where we think about what can we do going forward, what have we learned from COVID that's worked well, what hasn't worked, and how can we create opportunities where students feel welcome and safe in class, and what does that look like?
Fade to Minette.
What I would like to see is for ABC to have the opportunity to deliver more of this training, not only to groups of businesses and organizations or educators, but to individual businesses and organizations, as well as individual schools.
Cut to Christine.
It's critical that the Alliance for Equality of Blind Canadians continues this important work and gets more funding to be able to share these training programs and webinars with our communities.
Minette again.
I'd like to say thank you to the City of Toronto for giving AEBC Toronto this funding to provide services to people with disability who need service the most.
Fade to black. Text appears reading.
To support future AEBC initiatives, visit www.blindcanadians.ca/donate. For more information about this project, email aebctoronto@gmail.com or call 647-947-9022.